Breaking news. This just in. Studies show that people with skin of colour can get rosacea. Hi guys, Dr Sarah Tonks here. Today I am going to be talking about rosacea, but not any ordinary type of rosacea. Oh no. Today I am talking about rosacea in skin of colour. This is actually something that I see a reasonable amount of, guys, and that is why I am talking about it today, because often when we think about rosacea, we are thinking about people who have got skin types 1 and 2. Skin types 1 and 2 refers to the Fitzpatrick scale, which is something used in medicine to categorize people into different skin types according to how they respond to the sun. Weirdly enough, I don't see many people with skin of colour coming into the clinic to discuss their rosacea. And I think this is because it's massively underreported as a problem. This is because obviously on a darker skin type you can't see the redness and the broken capillaries that form part of this disease. However, in a US population study looking at people who have been diagnosed with rosacea, it found that of those patients, 2% were black, 2.3% were Asian or Pacific Islander, and 3.9% were Hispanic or Latino. So it's not just a disease of people from Celtic or Northern European origin. It has been shown to occur in all skin types. And unfortunately, because it's often misdiagnosed and underreported, it can lead to more advanced symptoms of rosacea. But it's just the same problem, you guys. It's just that you can't see the persistent facial redness, and sometimes post-inflammatory hyperpigmentation, which is more common in people with darker skin types, can mask any broken capillaries or redness that might otherwise be visible. In people with skin of colour, rosacea normally manifests itself with lesions either around the eye or around the mouth. The redness is much more uncommon. So if you can't see it, why is it a big problem? Well, rosacea isn't just flushing, redness, tingling, burning, itching of the skin. You can also have much more serious consequences of rosacea, such as problems with the eye or thickening of the skin of the nose and the cheeks. It's a potentially disfiguring disease. So if you suspect that you might have rosacea, but you're not sure, how can you tell if you can't see the redness? Well, you want to be looking for things like a warm sensation on the skin, flushing, burning feeling, a stinging, dryness, swelling, hyperpigmentation. There can be a previous history of acne diagnosis and treatment which failed. You might have triggers like stress, spicy food, heat, the sun. And it's worth bearing in mind that if you do have a mixed heritage, you are of a higher predisposition to developing rosacea. One thing to really watch out for is a diagnosis of seborrheic dermatitis. So often these two conditions can look the same, but if you've been treated for seborrheic dermatitis, that normally involves application of a topical steroid, which is not great for rosacea, and it can lead to hypopigmentation, thread veins, and thin skin. In fact, it's the absolute opposite of what you want to use if you have rosacea. Thankfully, the treatments for rosacea are exactly the same across all skin types. I'm talking about topical treatments such as metronidazole or azelaic acid, oral treatments, for example doxycycline, laser treatments, so in this case probably going to be ND-YAG, and it's really important in this group of patients to use sunblock. This is something which is often missed, and you want to be using a physical sunscreen if you can, either a zinc or titanium based sunscreen. Okay guys, let me know what you think about this different style of video. I tried to keep it a bit more choppy and more snippy than normal. If you prefer to hear me just rambling on like normal, let me know in the comments section below. Equally, if you're a busy person and you don't have time to sit around waiting for that, then let me know in the comments section below and I shall continue in the same vein. If you enjoyed the content, please subscribe to the channel. Stay classy, San Diego.